Saturday, and there are, as I see, there are more people joining, so I'm going to be just waiting for a couple minutes. And we are live on Zoom, and we are live on our Inside support group. And we're just waiting for a few more moments for everyone to catch up so we can start. I am going to put the link to the health questionnaire in case you guys don't have it. So just a moment, I will be posting it here. So basically, MexicoBariatricCenter.com health questionnaire, and I hope that's the right link. Yes, good. Okay, so that's the link you want. So basically, if you have not filled a health questionnaire, do so to be able to participate in our drawing at the end of the webinar. And you select Dr. Rodriguez Lopez as the surgeon of your choice. Correct. So you don't have to fill out a health questionnaire if you are on the calendar or you have submitted a health questionnaire. If you have a health questionnaire submitted before at any rate, you're okay. You don't have to resubmit it. Okay, so it looks like we do have a good amount of people joined already. So we're going to start our presentation. Okay, so again, I'd like to welcome everybody who has joined us on Zoom and as well as Facebook. The topic of our webinar today is collision of two pandemics, COVID-19 and obesity. So we happen to experience a pandemic beside obesity in our lifetime. And the COVID-19 pandemic basically shed more light on obesity. Today we have honor to present Dr. Rodriguez Lopez, one of our top surgeons, as the presenter with me. My name is Elli. I'm the CEO and founder of Mexico Bariatric Center. And we would have Dr. Rodriguez is performing a duodenal switch as we speak. So he should be finished shortly to join me to continue this presentation, but I don't have him online yet. So I'm going to continue the presentation until he finishes with the surgery and he would join me. Basically, this is a unique opportunity for you to enter a raffle that we have at the end of the webinar for $2,000 off surgery. And if you have not filled out the health questionnaire, and if you're doing it now, please go ahead and submit that and select Dr. Rodriguez Lopez. So basically that health questionnaire is what the surgeon looks at to qualify you for the surgery type that you're interested. And we would be doing the raffle at the end of the webinar presentation. So please, so the winner has to attend the webinar all the way to the end. Basically, we will be covering the obesity global pandemic, obesity and comorbidities, COVID-19 risk factors, weight loss surgery, what it can do for you, and what we can do at MBC, Mexico Bariatric Center, for you. At that time, Dr. Rodriguez Lopez will be talking about different surgery options, and then we take it to question and answers, and then we do our raffle. Basically, their BMI or body mass index is a simple idea or simple formula that you can plug in your weight, height, and it gives you a number. And that number determines where you fall into this BMI chart. If you look at the left side, where is all yellow, is all normal. As you get from yellow to the red, you start becoming from a normal weight to overweight to obese to morbidly obese. And what we call morbidly obese is a BMI of more than 40. Of course, this chart continues to 89 or more. So it's not just truncated at 50. So what we have experienced from this pandemic, from the quarantine time and the lockdown time, was a lot of people couldn't get exercise regularly, and a lot of us gained weight. And also the shopping was a challenge, so it was less fresh food that we could buy and eat. So as we know, there are underlying medical conditions related to being obese and overweight. For example, well-known conditions are type 2 diabetes, cholesterol, high blood pressure, heart disease, sleep apnea, fertility problem, PCOS, arthritis, certain type of cancers. And after COVID-19 became a global pandemic, then obesity was a high risk factor for COVID-19. So the question is, how do we cure obesity? Well, diet and exercise medicine is answer. However, not everyone is successful doing the diet and exercise. And if they do lose weight, it would be very hard to maintain this weight loss over time for a long-term solution. So bariatrics is a tool that gives people who have weight problems a quick, safe, and long-term solution. There are people who have insurance in US or they don't have insurance. The people who have insurance, their insurance may not cover the bariatric surgery, or the deductibles are much higher than what they would pay to come to Mexico to perform the surgery. And this is where medical tourism comes into picture. Medical tourism, basically, the concept is you travel abroad to get a surgery type that is hard to get where you are, or is very expensive to where you are, and you go somewhere else to get it. Mexico has established itself at the forefront of obesity, fighting with obesity and weight loss surgery. It's becoming the center for bariatrics worldwide. So people coming from US, Canada, all over the world, globe, to come to Mexico, especially Tijuana, to get surgery done, to get rid of obesity and the diseases associated with it. If we look at the death toll from all these different epidemics and pandemics that have hit us, this chart is about a month or two old, but it shows that obesity is basically killing about 2.8 million a year. The COVID-19 so far has killed about 1.25 million. So obesity still is about 2.5 times of COVID-19. And if you compare that with the flu and Ebola, SARS, and 1918 flu, which killed 25 million, still is a sizable number. There are studies after studies showing that obesity-related complications has a high risk factor for people who are suffering from obesity. Basically, roughly about 6 times more chance of a hospitalization and 12 times more chance of death if you have pre-existing medical conditions like obesity. So these are all research has been published recently in France with the ICU units. All the research is showing almost the same numbers. So people who are obese or overweight have a higher chance of getting hospitalized or dying from COVID-19. So it's a clear choice right now, and is clear for almost everyone that we all need to get rid of the medical conditions we have. including obesity, and lose weight and become less prone to this deadly virus. Bariatric surgery is an effective, quick, and fast, but long-term solution for obesity and obesity-related complications. Like I said, diabetes, high blood pressure, arthritis. And basically what bariatrics do is changes the body's set point or the body's thermostat. The chart, the graph on the right side of me is a good way of explaining the difference between diet and exercise and bariatric surgery. Let's say we are looking at this individual, which is in red, and he weighs about 250 pounds. And at this weight, this individual's brain is used to that 250 pounds. His brain, his hormones, the interaction between the brain and the hormones are comfortable at this weight. So the brain thermostat or body's thermostat is set as 250. If this individual goes through intensive exercise, we're talking about intensive regular exercise and diet. And let's say this individual loses 75 pounds. So now in the yellow, he is at 175 pounds. Remember, the body, the brain, still is used to that 250. So what is it gonna do? The body is gonna resist the weight loss. How is it gonna resist? It's gonna make this individual more hungry, and it reduces his metabolism. That's why the diet works the first week. After you go on, and it becomes harder and harder because your body is resisting it by making you more hungry, and it would not burn energy because it thinks like you're in the starvation mode. Now let's consider this individual go through bariatric surgery. Once the surgery is done and he wakes up, because the hormones and everything is changed, all of a sudden the brain and the body sees this individual at 175-pound thermostat. So what is it going to do? The body says, oh, I don't need all this fat. Let's burn it. So your metabolism goes up and you won't get as hungry. So your hunger goes down, your metabolism goes up. So what happens is you don't eat as much and you're gonna lose weight fast and quick, and you would maintain it because now your brain sees you at 175 pounds. Now we come to the part that we say, okay, so bariatric surgery is a solution for obesity, and I don't have insurance and it's so expensive in US and Canada to get the surgery done. So what do? That's where Mexico Bariatric Center comes to rescue. So Mexico Bariatric Center has been in business for so many years. We are a US-based corporation. Actually, our office is in Sacramento, California. And our mission since inception has been offering reliable, safe, affordable, but still high quality weight loss procedures in Mexico, mainly in Tijuana and Guadalajara. So we have performed to this date over 12,500 surgeries. And right now we are working with 6 top qualified bariatric surgeons in Mexico. So this is pretty much a resume of what we have done and tell a lot about who we are. Our process is pretty simple. It's 1, 2, 3. You fill out the health questionnaire online. Everything is happening online, virtual. Once you get your approval, you pay the $350 deposit. Again, online. You can do it online. Once you secure your spot, then you arrange for your travel, whether you drive or you fly. You do the paperwork. You get nutrition consult from our nutritionist, a registered dietitian. You start your pre-op. You are on your way to a new life. Our all-inclusive packages make the worry go away because you don't have to worry about anything. All you have to do is to get yourself down to San Diego. The rest is up to us. We pick you up, we take you to the hotel, we do the pre-op, we do the COVID test, we take you to the hospital, we do the surgery, we bring you back. You are good to go and start your new life. So, as we all know, unfortunately, coronavirus is still not under control. As a matter of fact, you keep hearing, at least in the US, that the number of cases are going up instead of going down. And the question is, so when is a good time? From the time that we opened up after the pandemic, we have put protocols in, we have put safety precautions in, we have learned how to deal with COVID down there in Mexico. And the question is, the answer is the time is now. Now is a time to go down there, take advantage of the VIP treatment, take advantage of a company who has been in business for so long, working with top-notch surgeons, and cure the obesity and the diseases, and not be prone to viruses like COVID-19. We have 2 teams of professional drivers who, for example, like Victor and Willie, have been working with us for years. And they will be bringing you from the San Diego airport area to Tijuana, to our facilities. We are bringing patients with social distancing in mind. We spray everything every time we make a travel, and our drivers are professional. They know what they're doing. First, you go to the hospital. We do the EKG, blood test, all the stuff that we need to do, plus the COVID test. We have the most accurate, most proven ways to detect COVID-19. If you can get this test done, the swab test in US, that's great also. I would recommend for people who have access to it to perform this 5 days to 7 days prior to getting down to San Diego. If for some reason you don't have access to it, we would do our own accurate testing and make sure that you, everyone else in the hospital, our staff, the surgeon, the drivers, the hotel staff, they're all safe. At this point, we are using Hyatt Place Tijuana. They are doing a fantastic job for us down in Tijuana with pandemic in mind. You wipe your feet on a solution, the sanitizer solution before you go in. The rooms are not occupied for 36 hours between each guest. So they allow 36 hours between each reservations. They clean everything to the max, and they've been doing a great job. Of course, you know, they are following Hyatt protocols. So once you spend the first night in the hotel in Hyatt, you be ready for the surgery for the next day. They tell you what time to show up in the lobby. They pick you up. You are going to the hospital. They're waiting for you there to prepare you for going through the surgery. We keep sleep patients 2 nights and bypass and duodenal switch 3 nights for gastric balloon, 1 night in the hospital. Once you're done with your hospital stay, you be on your way back to San Diego to either fly back home or drive home. Of course, there are some people that drive themselves to our hospital facilities and to our hotel facilities. So either way, we keep track of how you are coming and how you're leaving, and we would coordinate that for you. We mentioned about the team of surgeons we're working with. We have exclusive network of best surgical teams in I would say in all Mexico. Dr. Luisiana Valenzuela, our chief surgeon, she is actually a gastric sleeve patient that has performed her surgery with MBC. Dr. Gutierrez, he's a FACS. Again, these are not only general surgeon certified, they are board certified for bariatrics and metabolics. Dr. Rodriguez Lopez, which we have the pleasure to have him today, hopefully join us soon. He's one of our top surgeons again. He's our super surgeon. And Dr. Jacqueline Osana, which is working in Tijuana as well as Guadalajara. And Dr. Montalvo, which we have great success with him. Such a professional surgeon with a very good academic background. Why is MBC's complications are low and patient have high patient outcomes? Several reasons. The main reasons are, one of the things that we do is we cap each surgeon each day at 3 to 4 surgeries based on the complexity of the procedures. Another thing that is helping us is using a specialized bariatric hospital. This hospital we work with has been in bariatrics for, I would say, actually 10 years now. And they, day in and day out, that's what they do. They are dealing with this type of patients. They know how to sterilize things. They know what they're doing. So this combination, mainly this combination, have given us the best outcomes and lowest complication rate. Our complication rate is less than 1%. And if you look in United States, they are at almost 3%. Again, for people who are just joining us, I want you to fill out the health questionnaire if you've never done it before, and select Dr. Rodriguez Lopez and watch the webinar all the way to the end when we do our raffle. Dr. Rodriguez Lopez is our, what we call our super surgeon. I'm sorry, I'm trying to get an update on Dr. Dr. Rodriguez Lopez. Okay, I think he may be finished. Sorry for distraction. Okay, great. So he's watching me as I'm talking. So Dr. Rodriguez Lopez is our super surgeon. He is capable of performing anything from an endoscopic procedure and laparoscopic procedure. He is doing our gastric balloons, our sleeve, single incision sleeve, gastric bypass, mini bypass, duodenal switch, and any revision from the old VBGs to sleeve or bypass, reversal of gastric bypass, you name it, this surgeon can perform. And he joined us in 2017, and he has performed well over 3,000 surgeries. I mean, these numbers are pretty much old. And he's been instrumental to us after the pandemic because his wife is a pulmonologist, and both of them have been an asset to us to be able to work during the pandemic and still offer services to our patients. Like I said, this is a type of surgeries he's capable of doing, and I'm going to let him take over, and I would be watching him do his presentation, talk about himself, and talk about procedures that we perform. Thank you.
Hello, everyone. Can you hear me?
Yes. Yeah, you're muted right now.
Okay, can you hear me now?
Yes.
Hello,
nice
everyone. How are you?
Hi.
Nice to see you too. How are you?
Yeah, thanks for coming down.
Thank you for inviting me. I was
Okay.
on a surgery 10 minutes ago.
I'm going to go back to the presentation so you can take over. So you can talk about yourself. You can talk about all different surgeries. Thank you.
Yes. Yes, that is me. Well, I am from Tijuana, so I'm being here in Tijuana. But I did med school here in Tijuana, Mexico. Then I went to Sonora. That's a town near here to Baja California. It's about 10 hours from here. And I did general surgery. After general surgery, I did transplant surgery. So I'm also a transplant surgeon, kidney transplant surgeon. And after that, I did bariatric surgery. So I believe I have a lot of experience doing this, and and I love what I do. I believe bariatric surgery can improve a lot of things in the quality of life of our patients. So I love what I do. Thank you for being here in the webinar. If you have any questions, feel free to ask, okay? So here in the company, we can do all the bariatric procedures. We can do all the bariatric surgeries and all the bariatric endoscopy procedures, all the revisional procedures. So I believe Mexico Bariatric, it's the most important weight loss company here in Mexico. I'm so glad to be part of this. So we're gonna start talking about the gastric sleeve surgery. The gastric sleeve surgery, it's a restrictive surgery, and the surgery, it's only in the stomach. We can do surgery in the stomach and also in the small bowel. In the gastric sleeve, the surgery is only in the stomach. So we do everything laparoscopy. It's a minimally invasive surgery, and the recovery time is really, really short. In the gastric sleeve, we remove the 80 or the 85% of the stomach. So this is a really, really restriction surgery. The part of the stomach that we remove produce the hunger hormones, the ghrelin hormones. So all the patients will be feel fullness earlier, and they will not feel hunger in the first 6 months. So this is gonna improve or make the diet more easy. So I love this surgery. I believe this is the surgery that the most popular surgery at this moment, because it's having a lot of great results. Why only 6 months is the hunger reduced? Because other part of the body produce the ghrelin. The brain and the pancreas can produce the ghrelin hormone. And so that's why the first 6 months is when we have the most benefits of the ghrelin hormone, when we reduce the ghrelin hormone. More questions? So the results of the gastric sleeve surgery, we can have we can lose the 65 or 70% of the excessive weight in the first year. So this is a real cool example of what you can get with the gastric sleeve surgery. Every patient is different, but this is a real common explanation about how many pounds you can lose with that gastric sleeve. Let me check the questions.
So we are going to answer the questions at the end. Is that what you're looking for?
Yes. Okay. At the end.
Yeah. We'll just continue, and let me know if you need different slides. But
okay.
We would wait. We would just answer everybody at the end.
Okay. So the gastric bypass. The gastric bypass, the surgery, it's in the stomach, but also in the small bowel. This is it's a different surgery, more powerful surgery, because this is a restrictive surgery and also a malabsorptive surgery. So it works in different ways, in the stomach and then small bowel. So in this surgery, we can have more weight loss. We can expect to lose the 70 or 75% of the excessive weight loss in the first year, but also it can have more long-term weight loss results with the gastric bypass. Um, I really like this surgery because patients can have, uh, in the gastric sleeve, patients can have more nausea. In the bypass, there's no nausea in the gastric bypass, so patients are more asymptomatic. So can I have the next, please, Ron? Well, this is what are we doing now to prevent COVID infections? At this moment, the pandemic show us a lot of things, and sanitizing is the most important part. All the personnel of the hospital, all the surgeons, all the team in Mexico Bariatric Center, we are using all the infection controls that are indicated for hospital and weight loss surgery. So at this moment, we don't have patients infected with COVID-19. So that's really, really important. I worked in a hospital with COVID patients, so I bring all the information to prevent our patients, so you will be face safe in our hospital. So, um, and also in the hotel. What should you should be doing to avoid coronavirus? Okay. Can I have the next, please? Social distancing. This is really, really important. You have listened a lot of this in the news, in the TV, in the social network, but if we just follow all the indications, we cannot have infections in the airport, in the hotel, and in the hospitals. So we just need to follow all the instructions, wash our hands, use face mask, use sanitizing, uh, social distancing. If we do this, I'm 100% that you will not get infected of coronavirus. 100%.
Okay, so I'm going to take over and continue to finish it off so we can get to our question and answers.
Okay.
So again, our packages are all inclusive and very affordable. If you still need financing, you could look into our partners, e-financing, United Medical Credit, Medicard specifically for Canadians. And if not, you can look at other channels like SoFi, Best Egg, Lightstream, Lending Tree. But what I recommend is do not apply to so many at one time. Let's maybe do one or two and wait for them. If you didn't get it, apply for more, because once you apply for so many at one time, it would affect your credit. It will be harder to get your loan. Okay, so we are to the question and answers. I was just reviewing everything. So they're asking, one of the patients is already scheduled for gastric sleeve, and they're asking, is it easier on me to do single incision as far as recovery time and pain, level of pain? So if you want to talk about what are the advantages of disadvantages of single incision, of course, the BMI is a factor whether they can get single incision or not.
Yes, the BMI, it's one of the most important part of for doing a single incision surgery. Normally, BMI 30 through 40, it's a good BMI for single incision, because in single incision, we use different equipment. So the BMI, it's really, really important to doing this, because safety is always the most important part. So, and sometimes with patients with high BMI, it can be really difficult. So we prefer to do only BMI through 30 to 40. That's the most, I prefer to do that in single incision surgery.
Patient is asking, I had thyroid cancer last year and I removed it. Have you worked with thyroid cancer survivors? And
yes, thyroid, breast cancer survivors, colon cancer survivors. Yes, of course. Yes. We only need oncologist's release letter if just to check all your health questionnaire. But yes, if your oncologist is okay, we can do the surgery.
this is a difficult one. They're asking, they had duodenal switch 11 years ago.
Okay.
And can I reverse it?
Well, yes, we can do it. It's not easy, but yes, we can do it. Why you want to be reversed?
Yeah, that's a good question. Hopefully they would reply back to why is it that they want to reverse the duodenal switch? They're asking what percentage of patients had complication with bariatric surgery that may have had other underlying conditions.
Well, the complication rating in our company is less than 0.03%, so it's really, really low. We are under the normal statistics, because I believe we are really experienced company. So yes, our complication rate is really, really low. It's lower than normal statistics.
They're asking if I am over 200 pounds, is the sleeve still a good option for me?
Well, you need to lose 200 pounds, okay, correct? So if you need to lose 200 pounds.
No, I think they are over 200 pounds. They're just saying if I'm over 200 pounds, not 200 pound extra rate.
Oh, okay. Well, yes, a gastric sleeve can be a good option for you, yes.
This is the one, it's about basically coordination and logistics. They're asking, do I have to be in San Diego to meet your driver by 11 a.m.? And they're all, so basically, we like everyone to get to San Diego before noon, so we can easily do the blood test and COVID test and EKG, whatever. However, if you can, you still can be picked up, but it makes it harder. Some of the other options, I understand some of the flights may not get there on time. What options we have is for you to stay in Hampton Inn in San Diego. They have a special rate of 100, I believe 19 plus tax for our patients. So if you mention Mexico Bariatric Center, they will give you that offer. And then our driver picks you up the next day. So you take the shuttle, You go to the hotel, you stay there at night in San Diego, beautiful there, and then you just get picked up tomorrow. But yes, we do like you to be there before noon to get picked up. What are the risks that weight loss surgery has in general? What are the risks?
The risk, bleeding is the number one, and a leak is the second one. Pulmonary embolism is the third, and heart attack is the fourth. But we take all the, we do everything to prevent this. We're always thinking in prevent complications. That's why during surgery, we always check for bleeding. We always use the best equipment to prevent leaks. We reinforce all the staple line surgery. We always use medication to prevent embolism. So we're always thinking in preventing complications. That's one of the most important part in the company.
They're asking if I get prescription from my doctor in the United States after surgery, will it be safe to take it, or should I wait after the surgery to take my medication?
You're gonna be sure safe to take it, without problem.
But remember, when they do the health questionnaire, they put all the health history, they put all the medications that they are taking or they're planning to take, and then you guys are telling them what to take and what not to take, and that would be with our surgeon liaison and the coordinator to tell you, okay, stop this, for example, 1 week before, don't take any blood thinner or whatever, right? So you would recommend what they need to take or stop taking. So just put that in the health questionnaire, and the surgeon liaison, they will let you know. Here's a question that I get a lot. They say, what size boogie do you use, and does it matter how large it is? And if it's larger, does it avoid the side effects with sleeve surgery?
Okay, we use a standard recommendation that is a 36 gastric calibration tube or boogie, and for gastric sleeve. In gastric bypass, we use a smaller, it's a 32 boogie, French gastric calibration tube. And when we are doing a duodenal switch, we use a 40 French gastric calibration tube. As the gastric calibration tube is really, really important. It's part of the steps of the bariatric surgery. And yes, it's really important to choose the best boogie size for each patient, yes.
So what do they do if they get complications after surgery? Of course, you want to discuss when they're down there and discuss when they leave and they come back home.
Well, we always take care of the complications that are here in Tijuana. You never be alone. If you have a bleeding, we always gonna fix that. And we're gonna help you with everything. I promise that. So if you had a complication in the United States, we can always be in touch with your doctors, with you, with your relatives to help you for all the information that you will need to resolve your complication.
So there is a patient asking, would you do DR if I come back? I'm not sure what is DR.
DR? No.
Anyway, I asked what DR means. We will find out. So they're saying pre-surgery, I was 235. As soon as I got home, my weight balloon is 285. Mostly water retention. I had gastric bypass. When should I start seeing weight loss
Oh,
results?
DR, diastatic rectic. Okay. Okay. I'm sorry.
So they're saying when before surgery they were at 235. They got home. They got to 285 because of the water retention.
Retention. Okay.
So what they're saying, when should I see weight loss results?
Well, sometimes it's normal to have water retentions because we use IV solutions, and you can start. You will see the difference probably in the first 2 weeks after the balloon procedure.
Oh, she meant 250, not 285. I thought that's like 50 pounds of weight
Yes.
gain. Okay, yeah, that's good. Okay. Maria is asking if we are concerned about blood clots or complication after surgery, can we opt to stay under your care longer than normal? For instance, we can stay in hotel and do checkups. Of course, we
Yes.
do
Yes.
recommend especially if you're traveling long distances, stick around a couple days more in Tijuana and make sure you're good to go. Oh, they're asking for revision of duodenal switch.
Well, revisional. Yes, we can do revisional for duodenal switch, but we only have one option, is to make the common channel smaller. We need to check all the anatomy to understand what is going on, because duodenal switch is one of the most powerful weight loss surgery. But yes, there's an option for revisional. We can do the gastric sleeve part smaller. Sometimes with the time can get stretched, so we can reduce the size of the gastric sleeve, and we can also make the common channel smaller.
Okay, so that was my bad. That patient, actually, you got it the right way. That patient, Alicia, needed to lose 200 pounds, not
Okay.
she's over 200 pounds.
Okay, well, I believe the best option could be at the gastric bypass or the duodenal switch. Yes.
What if I have hiatal hernia? Would you do the procedure to fix it?
Yes, of course. It's really important for us to repair hiatus hernias, because if we don't repair, you can have acid reflux, and no, we need to repair all the hiatus hernia, because it's going to improve the acid reflux. So yes, we will fix it. We always fix it.
So is gastric sleeve successful for people who need to lose 125 pounds?
Yes, we have patients that with that numbers, but discipline, weight loss surgery, it's a good combination. If you follow all the indications about the diet, exercise, yes, I believe you can lose 150 pounds. Yes.
I'm a swim instructor. How long after surgery can I get to the swimming pool to teach?
I believe 3 weeks after surgery.
Do you also perform revision of sleeve to bypass?
Again, please.
They're asking if we perform sleeve to mini bypass revision.
Yes, of course. Yes. That is something that we do a lot.
Crystal is asking, I'm scheduled for sleeve. My BMI is 35, but I have had severe nausea in the past. It could have been due to alcohol. Could sleeve make it act up again?
Well, just the first 2 days. Now, we're gonna use IV medication, then it's gonna help you with that, but just the first 2 days after surgery.
What type of staples do you use for gastric sleeve surgery?
In gastric sleeve, I like to use Ethicon staples and staplers. And in gastric bypass duodenal switch and provisional surgery, I like to use Medtronic staples.
So just to add to this, these are the same brand names as used in the United States, FDA
Yes.
approved.
Yes.
Are we not using some off-brand Chinese or some black market?
No, Ethicon is Johnson & Johnson.
Yes.
Staples, yes.
If you're struggling with food, how do you overcome that? I think they're talking about head hunger and, you know, if you're addicted to food.
Well, the gastric, the weight loss surgery is gonna help you with the restriction. You're gonna feel full with little amounts of with food, and there are a lot of hormone change. So that's gonna improve all the hunger situation. The hormone is gonna, the ghrelin hormones, all the digestive hormones gonna be different. So those hormones are gonna help you to lose weight and handle all the food struggle situations.
They're asking, what is the highest A1C that I can have prior to surgery for diabetes? A1C, like diabetes?
Yes. I believe it's, if you have a good control of glucose levels, it's better for us. But I understand that there are some patients that it's really hard to have a good control of glucose. So I believe 9 is the highest hemoglobin glucose level. That 9.
Okay, the one that was DR was my bad. So it stands for I don't know if I'm saying it right, diastatic rectic.
Yes. Well, it's better to repair all the muscles after weight loss, probably 1 year after the weight loss surgery. Plastic surgeries can help you with that, but yes, it could be repaired. Yes, without a problem.
How soon after surgery do we need to get our labs done, and how frequent after that?
The first month after surgery, and then every 6 months.
So are we doing DR?
Yes, it's part of the plastic surgery repair.
Yeah.
Yes.
So for anything related to plastics, you need to talk to our plastic division, which Flora is in charge of that. I'm going to put her number on the board so you can call her and she would set you up. Okay. It's very challenging because I keep answering and then I get more, so I'll scroll down. So to go back. How is it determined the order for patients for surgery? I'm not sure if they're asking the surgery on the day of the surgery, who goes first or who goes last. I think if that's what they mean. So basically it depends on the workload of the surgeon, the workload of the hospital, the program come the day before. They let us know who goes first, who goes next, and accordingly, we tell our coordinator, the coordinators tell the coordinator in the hotel to tell you what time to show up down in the lobby to get picked up. So you don't have to worry. Once you're there, everything is gonna go next. Um, Here's a question for you. That's a good one. How do you rate yourself compared to USA? I heard you are lower than USA.
Okay, I did not understand.
So they're saying, how do you compare the surgeons, you guys, the surgeons in the United States? And they said that they heard that you're lower than the US surgeons.
Well, well, I believe the medicines in Mexico is different. I think all the surgeons here in the company are really skilled surgeons because the way we do medicine and surgery is a little bit different. Probably we don't have all uh, in the medicine school. We start really young to with patients. Um, we do a lot of surgeries in the first months after we enter to the surgery residence. I believe we have a more experience, hand experience. So I don't know if we are better or they are better. Well, I believe we are different. But we have patients that are doctors in United States and they watch how we do surgery and they're impressed because they say we are really, really skilled surgeons with our hands. So I believe, yes, that's it's a difficult question.
Yes. Well, I can probably chime in on this one. Basically, like Dr. Rodriguez mentioned, the surgeons down in Mexico start earlier being hands-on. And a surgeon like Dr. Rodriguez is only 30-some year old, and they have done thousands of bariatric surgeries. So the young surgeons with so much experience, and this is done laparoscopically, so it's huge to have that hand-eye coordination in the young age and be able to have the experience behind it to perform all type of surgeries. And they are equipped, they are ready for all the unwanted or surprises during the surgery because they know how to handle all type of complications that comes with the surgery, and they are ready to go. They are knowledgeable. They have the skills and the experience to handle all the, um, you know, again, unwanted scenarios that can happen. They're asking, is there any insurance for possible complications? Yes, it's very simple. We work with a third-party company and GPS. We do have it in our forms that you can click and apply and get the insurance. Usually it's about a few $100s. If you feel safe, that would have coverage in US as well as Mexico. It has the, the airline delay or whatever coverage to complication coverage. So that could be a good peace of mind to buy that insurance. They're asking how long it takes to do the pre-op blood work and EKG. Well, basically couple hours. But remember, we also do COVID test. That's why we want to give ourselves enough time for you to get to San Diego before noon. So we pick you up, we take you to the hospital, we do all the tests. Okay, so that's why we want you there before noon. They're asking, should I bring a companion with me? Well, almost more than 50% of our patients come alone because we do have staff all over the place. Of course, the hospital, the hotel staff are still around, but we have our own coordinators that they help you. So it's not necessary, but if you feel safer coming with a companion, it's great. Remember though, because of COVID, the hospital is not allowing companion to stay with the patient. So the companion would stay with you the first night in the hotel. However, the second night, the third night, they will be in the hotel. They're saying if I stop all my supplements before the surgery, should I get IV infusion prior to the surgery, like magnesium, calcium, vitamin B, and C?
Well, it's not necessary an infusion, but if you want to do it, you can do it without problem. Yes, but it's not necessary, but you can do it.
They're asking about revision of the bypass. They're saying maybe my pouch have been stretched, and what are the possible causes of weight gain after bypass?
Okay, the first option is the gastric pouch is stretched. The second option is the junction between the pouch and the small bowel, that is the anastomosis. It's really big. Normally, the size of the anastomosis is 2 centimeters, 1.5 centimeters, but with the time it can get 5 centimeters. So in revisional surgery, we always do the gastric pouch smaller and the anastomosis is smaller, and we also make the one of the loops, we make the malabsorption part bigger. So that's a revisional of the bypass.
They're asking what's the difference between a bypass and a regular bypass? Mini bypass and a regular bypass.
Well, in the mini bypass, we only do one connection. We only do one anastomosis. It's the junction between the stomach and the small bowel. That's the mini gastric bypass. In the traditional bypass or Aaron-White bypass, we do two connections. One is the same as a mini bypass between the stomach and the small bowel. And the second one is a connection between the small bowel and small bowel. So we have two connections. We have two anastomoses. That's the most important part in the difference between mini bypass and gastric traditional bypass. And in the traditional, we can improve acid reflux, biliary reflux. So that's the main difference.
Okay, so there's a lot. They're asking about the follow-up once they get to the U.S. Yes, we do have our nutritionist reach out to you to check with you after you return back home. As far as the vitamin, I mean, remember that MBC is giving you support before and after surgery. We have a Facebook support group, more and the questions are answered. We do have every other week webinars for what to do pre-op and post-op. And all these questions you have, you can ask our nutritionist, dietitian. As far as the vitamins concerned, we do offer Emerge Bariatric's line of vitamins, which is specifically made for bariatric patients. They're asking, what's the difference between sleeve and a bypass? Pretty much they can use the same one, a little different. We do have that too, just the bypass patients can take, but we highly recommend that you take vitamins, bariatric vitamins, not gummies, not Flintstone, not multivitamin, bariatric specific vitamins. And what Emerge does is Emerge is made according to the ASNBS guidelines. And they're the best vitamins you can take. After the post-op, you can wait 1 week before you start taking your vitamins. And again, Emerge has 3 kinds of, it comes in 3 different ways: chewable, soft chew, and drinkable. So you can use any form that fits with your stomach and makes you not feel nauseated. So I just lost Dr. Rodriguez, and about the nausea, the surgeons would prescribe medication once you're doing your surgery, and they will monitor you. Of course, the nurses, that they will give you medication, you won't have that. Again, the hospital has strict guidelines from the federal government right now from Mexico not to allow companion to stay in the hospital. You do have limited time based on availability of our staff, because they need to monitor you coming in and going out to visit your patient, and usually that's done in the afternoon, because once the patient comes out of the surgery, they're not quite awake yet. But you hopefully have a chance, your companion, to come and visit. Let me see what happened. Yeah, we lost Dr. Rodriguez. I'm not sure if it was a glitch in T1. So if I were to give you one piece of advice prior to the surgery, was doing a good job on the pre-op diet. The better job you do on the pre-op diet, and the pre-op diet basically is based on your BMI. The higher BMI, the longer the pre-op, but it's not a very difficult one. You just have to cut the carbs and take protein shake, salad, fish, or chicken. And the better you do on your pre-op with the 2-day liquid diet, clear liquid diet, the easier the surgery on you and on the surgeon. Now, the actual surgery takes from start to finish for sleep about 1.5 hours. The actual surgery is about 40 minutes average. For bypass, is probably twice. Same with duodenals, which is even longer. You can order your vitamins on emergebariatrics.com. If you were to be in, if you live in Mexico, we have to make some kind of arrangement to get it to you. Just a moment, let me see what happened to Dr. Okay, I guess Dr. Rodriguez left for surgery, and I'm going to try to answer as much as I can. Again, anything diet related? Yes, so we do require pre-op diet, and any question you have about the diet, our registered dietitian can answer you. Then one of the purposes for doing the pre-op diet is to shrink the liver, because liver is on top of the stomach, so they have to lift it and cut the stomach. Therefore, the lighter the liver, the easier the surgery. Also, it gives your stomach room so they can put the instrument in there, because remember, this is done laparoscopically. Our presentation is going to be online, and hope if you ask the coordinator or one of us, we can send you the link after we're done. Okay, so yeah, unfortunately we don't have the vegan vitamins. We just unfortunately we don't carry that. The recovery time is usually 1 week to 2. Again, depends on the type of work you do. If you work in an office, it's easy. You just be a little tired. You're not supposed to lift heavy weight. If you're lifting heavy weight at work, wait a few weeks, like 3-4 weeks. Basically, who is at high risk? It's hard to say. This is a surgery, and when you do surgery, body may have a reaction that you may not imagine. So we can't tell you, or if you are over 40 BMI, or if you are a woman or a man, it will make a difference. It really doesn't. And it all comes to your body's reaction and the surgeon's skills and how they monitor you after. Again, workout, you can start walking, you can start doing light exercise a few weeks before you get to the swimming pool, but heavy lifting and stuff, you have to wait at least 6 to 8 weeks. Yes, so the first night when you arrive, we take you to the Hyatt Hotel, and that's still the case. If you have COVID, we want you to wait until you get negative results again with the swab test, and then submit it to us, and then you're free to come down. Your age, usually our cutoff for age is from 15 to 62, but there are exceptions. When you're over 60, depends on your health condition. If you're doing well, the surgeons will take you. If not, then they have to go case by case. Yes, so if you are scheduled for a certain procedure, you still have a chance to talk to your surgeon prior to the surgery when you get down there and determine if this is the right procedure for you. So it's not like if you were scheduled for bypass and you get down there, they're gonna just close their eyes and do the bypass. They still will talk to you, make sure you're comfortable with what you're getting. You can do your CT scan before you come to Mexico, but we will do the CT scan once you arrive. And that is the first test we do for COVID. Our hotel and hospitals are in prominent areas of Tijuana, and they are extremely safe. Hotel, you can actually walk around. There is plenty of places to go, very nice areas. The hospital is the same, is in a zone which we call Zona Rio, and it's completely safe. You can bring a companion, like I said, but the companion stays the first night with you, but they won't stay in the hospital with you. Limited visitation. As far as our vegan supplements close to our MBC line of vitamins, I'm going to have to refer that to Prabha, which is our registered dietitian. She's very knowledgeable. You can ask her. Her email is nutrition@mexicobariatriccenter.com. So basically, you would be taking clear liquid 2 days prior to the surgery. And that comes in our pre-op instructions. So anything clear, even there are clear protein drinks that you can take, but certain type of, basically we give you a list of things that you can take. Okay, so it looks like we pretty much went through all of it. About 90 some questions got answered, and I don't have any open ones. I still have a lot of you tuned in. I'm going to try to get the raffle going. These are pretty much our patients before after pictures. We have tons of success stories, tons. And again, this is the bariatric vitamins I was talking to you about, and you can get it from emergebariatrics.com. And let me see about, okay, so I am asking for the winner of the webinar to announce. Okay, so Paola Sales. If I said the name wrong, I apologize, but let me see here. Paola Sales. I'm going to let you talk if you like to. And hello, do you hear me?
Yes, I hear you.
Hi, how are you?
Good, thank you.
I'm so glad that you joined us for the webinar, and it looks like you're the winner of the webinar.
Oh my goodness.
Yes, yes, congratulations from
Wow.
Mexico Bariatric Center and Dr.
Wow.
Lopez. Were you on the calendar already, or?
Yes. I had already done the questionnaire.
Questionnaire? Okay,
Yeah.
okay, well, great. And when are you thinking to perform the surgery?
I was thinking the beginning of next year.
Okay, awesome. Yeah. Yeah. So what is going to happen is, do you know who the coordinator was that you were working with in NBC?
I don't remember.
Okay, no problem. So you would have the coordinator that you work with contact you and arrange for your surgery, and good luck with everything. Yeah, January is the perfect time to go down there.
Oh
And
my goodness.
yeah, so Kathy Zimmerman, she's the one is your coordinator. Okay,
Okay.
so you can call our office too, 855-768-7247. And yes, congratulations again. Thank you so much for everyone to attend the webinar, and we will see you in the next month informational webinar we have. Thank you so much.
Thank
Take
you.
care.
Bye-bye.
Goodbye.